So welcome to this episode of the Rumble. This is not the usual Rumble where I just rumble with one person. So I've got four people to go with at the same time. But I have an interesting mix. So I have with me Dr. Ajit Mullasheri, who is a cardiologist based in Chennai. And next to him, I have Ravi Shankar, and he's a Nadi Vaidya. I would dare say the Nadi Vaidya is the way we used to say it in the old world. Today, I think there are new ways of saying it.
I'm a life coach.
Life coach. All right. So that's a brand new way of saying that. Then we have Nandi Gopal, a nutraceutical formulator, one who makes medicines out of...
Pharmaceutical is the medicine, nutraceutical is the nutritional supplements, health supplements.
Those who make that kind of thing. So is that a brand new field? Or
It's quite new, but it's almost 10 years now in India.
And finally, I have Luke Coutinho. Integrative medicine is his specialty. I guess when you say integrative medicine, is integrative not just the medicine, but the way you treat. I mean, all aspects of medicine get together. Is that the way you...
Absolutely. Mind, body, emotions, everything, right? From food to exercise.
Surgery,
if I have to work on such a case, then we will work with surgeons.
Okay. So now, what we're doing now is just trying to get a fix on how does all the newer type of medicinal practices work in today's times, particularly when almost everybody is certified to be ill in some form anyway. Everybody's ill all the time. So let me just start with the Nadi Vaidya. This is something that I've heard of. In Kerala, we hear this name quite often. But can you just tell us what exactly does it mean?
Yeah, Nadi actually means flow. Now, we are all beings which are thinking all the time and reacting, acting, etc. So, it's all a mind and a body mixture. So, Nadi means flow. Flow of your mind, flow of your thoughts, your emotions, your feelings, which are translated down to the way the body reacts to what the mind is saying. So, you have your enzymes which are reacting, you have your acids which are reacting. Then you have the way various organs react. For example, the heart, the lungs.
It starts to race when...
Yeah, exactly. So, because if you look at it, your emotions control your breath. So even that's a flow. So Nadi understands the flow of everything that's happening from your mind translated down to the body, and how the body is functioning, what are all the symptoms the body is displaying, what is the primary cause from where it all started, what is the secondary cause, the primary symptoms, and what are they displaying, the body is actually talking. So Nadi tells you what the body is trying to tell me, where exactly I'm having a problem, what are the expressions of this problem, and how to deal with it for how long it takes.
It's kind of delightfully vague when you say flow. Nobody can really quantify any of these things that you're saying. Is it like a science, or would you call it
pure
more
science.
like
It's pure science, yes. In fact, Ayurveda actually has to be working through the Nadi pariksha route only. Because if you have a pathological report has no significance to what is happening in the body. It's just a statistical mean taken over a million people. So just number doesn't give you anything at all. But Nadi actually gives the actual pathological reference that's happening in the system. Why it is happening, what's the cause. So Ayurveda actually always tries to arrive at the cause, the root cause. And
Doctor, what do you think about this? Is it something that you...
Well, I think that in a way what Ravi said is absolutely correct, but how do you quantify all this? It can't be abstract, it can't be vague. We need to know what is this Nadi. If I ask, how do I measure the Nadi of this gentleman?
Ask him directly, what is Nadi?
How do I measure somebody's Nadi and say that, okay, this is a bad Nadi, this is a good Nadi, this is the Nadi I need to influence, or something like that.
Absolutely.
And that is the real key. So if you ask me, as I completely agree with you what you're saying, that the mind influences the body a lot. Not necessarily always, but it's a big issue in terms of how the body reacts. But when we do this, we need to measure it. And measurement is the basis of all...
Yeah, allopathy itself is based on quantifying specifically. And in your kind of case, it's a little more...
No, I have all the reports with me, which actually are measuring...
What reports are you talking about? The same things that come from a lab?
No. Nadi pariksha, in fact, I have formed a report which tells me where the patient stands today, where the patient would stand on his next sitting that he has with me subsequently. So you can actually measure the reports based on Ayurvedic principles. So these reports are all quantifiable and they are all on the parameters of Ayurveda. So any Ayurvedic doctor, when he sees my Nadi Pariksha report, he will actually understand where he stands, why things are happening, and what are the parameters that I'm following.
And you take account all these kind of things and formulate specific medicines, or is this yours is generic and then he uses them?
No, actually, I think what he is talking about the quantum healing, it's energy healing, more of body within healing itself
Okay.
through some kind of lifestyle changes, breathing changes. In US, there are therapy called energy therapies going on in accepting.
Oh yeah, there were magnetotherapy and all these.
That's a different branch. But even this quantum healing process, they take up this energy flows in the body. They have different plexus.
So you have sensors. In your case, do you have any sensors along the body?
I am the sensor.
Oh, so you will do everything.
Yoga Ratnakara is a book which is used in Ayurveda.
Okay.
Yoga Ratnakara talks of Nadi Pariksha. In fact, the first 120 pages of Yoga Ratnakara actually talks of what is Nadi Pariksha, why Nadi Pariksha has to be done, and there is something which is called as Ashtavidhi Pariksha, which means Nadi Pariksha is one of them. Then you understand the prognosis by understanding what are the expressions on the skin, expressions in the eyes, expressions in the tongue, expressions on the face, expressions in your voice. Okay. So these are the 7 expressions in the urine and stool. So whatever I'm finding on the Nadi, they have to be expressions which are simultaneously on the body also. So what the Vaidya says, I may probably be in some frame of mind while I'm doing the Nadi Pariksha. So to authenticate my reading, I need to see if these parameters are also coordinated and gelling with my report. So it's a foolproof science.
Let's see. But it's entirely intuitive. I mean, there are no machines or anything to...
No, it's totally intuitive.
You have to figure it out.
Yes, in fact, a patient is not supposed to tell me anything in advance, and I'm telling the patient what the patient exactly knows. So it's actually a science which proves itself, because the patient actually tells me, yes, I'm surprised, this is exactly what I'm suffering from. But the patient does not know why he's suffering, I'm telling him the cause.
Okay. And Luke, where do you come into this? And when you get somebody who comes to the report from somebody who's doing Nadi Pariksha, would you be able to interpret that?
So see, in the field of integrative medication and medicine, we use talent from all fields of medicine.
Okay.
So yes, a cardiologist is definitely necessary. His method would be definitely necessary. For example, I specialize in 4th stage cancer, and sometimes the healing is blocked. Even the chemo doesn't work because of emotions in the person's mind, or when the patient starts giving up. You can literally predict when the patient is going to die. But then I don't have the expertise now to help the patient emotionally. Okay. So I would definitely use a skill like that. I would definitely use a nutraceutical which can detox the body from the side effects of the chemo. And I would use the expertise of a cardiologist as well if some medication, and chemo does create cardiac arrests and strokes. So you're going to get fixed for cancer, you die of a heart attack. It's one of the side effects. People get cardiac arrests all the time.
Yeah.
If they can't take someone entering chemo with a weak heart, I would definitely want the oncologist to include a cardiologist on the team as well.
So are you part of the team of oncology?
Some drugs for oncology, like say doxorubicin is a very known drug which is used in oncology, which creates a muscle disorder, cardiomyopathy, which is a muscle dilatation of the heart. So if you're going to use that drug, you need to be careful. The problem today in many of the allopathic medicine, it's like a gunshot sort of treatment. So in trying to annihilate the cancer cells, you may do damage to normal cells.
You kill off a lot of other
normal cells. That's why you lose hair, you lose your, when a buccal mucosa, mouth ulcers come in, the tummy gets upset. So the problem today is to identify what is the mischievous cells
and target
the problem.
Precisely.
Target it precisely. And you can do it to some extent today. That's what nanomedicine is all about. You try to target that specific cancer cell and hit it without hitting the normal cells, so that the side effects of the treatment is not there.
And these are all done through your diagnostic skills, intuitive, or as a doctor, or through instruments only?
Well, medicine has, I agree completely what everybody is saying. There's nothing in medicine which you should exclude. You should take the best out of everything. And a lot of the chronic lifestyle disorders are basically a disorder of the system. It's not like if I treat diabetes, blood sugar only, my cardiovascular disease will come down. Or if I treat my blood pressure only, my cardiovascular disease will come down. My heart disease or stroke will come down if I treat the whole patient or the whole person. Then it's like, But unlike that, say an acute meningitis, suppose I get a brain infection. If I start treating that in a chronic basis, trying to treat the system, the person will be dead because that's an acute problem. You need to fix it with an antibody.
Go directly for that.
Go directly for that. So these are two different things. Cancer is a sort of chronic problem which slowly steps in, which is multiple problems, environmental, genetic, plus carcinogens and everything, which then make the cells mischievous, behave badly, and grow out of order. And there, yes, if you prevent it with lifestyle issues or treat it as a person as a whole early enough, you can prevent. But when you're too late, say in the stage 4 cancer,
they're not so effective.
These sort of treatments are not very effective because they will do more harm to the patient overall because the cancer cells are all over the place, and you're trying to treat it like a gunshot, you will kill the normal cells.
Yeah. So what kind of diseases would you say your practice of Nadi would be
Frankly speaking, I am not disease specific at all. Because
No, what
first of
would you
all, I tell the
say
patients, don't tell me what you're feeling. Say, for example, a person comes to me and says, usually patients make a lot of effort in trying to remember the kind of ailment they have, so they take a lot of time in giving this whole big list of ailments that they have, and they use all these allopathic names. So I tell them, okay, fine, just leave your.
What do you mean use allopathic names?
I don't know. I cannot. Can you use some names?
Diabetes, hypertension.
No, that's very easy. The larger ones, something the patient actually thrives on. He says, I got this big.
He loves those big words.
Yeah, those big words.
Okay.
So, in fact, I'll tell you something. I met with an allopathic doctor. He is a heart surgeon himself. He said I have atrial fibrillation. In fact, a heart patient knows that atrial fibrillation is not curable.
Okay.
They say he's been medicating himself for 22 years. Am I right? Now, this doctor, he came to me. He was referred to me by a common friend, and I cured him in exactly 2.5 months. Now, I'm talking of a cure. A cure where a cure, I mean, is that it doesn't exist in him anymore. And he is referring his patients to me today. He's from Bombay, from KM.
So what exactly is this fibrillation?
Well, it's actually where the heart is. The heart is not able to pump enough blood, and the blood is not flowing in the same sequence, and the beat of the heart is always varying.
Okay.
Yeah. So he said this is not curable, and this is totally emotional.
No, but is that fatal? Is this a fatal condition?
Atrial fibrillation, just to be specific, what he's saying, is an upper chamber of the heart abnormality, where instead of beating at 80 times a minute and conducting in the same way in the lower chamber, the heart beats a little erroneously at a very fast heart rate. And the problem is, yes, atrial fibrillation is a disease of aging. It is a disease of many valvular heart disease.
It's emotional. In fact, I found that it was emotional because he was actually challenged by his wife at every step.
I knew this wife will step in somewhere at some point.
So what happened was, when I made him look at the better part of life, of course she is the best part of his life, but I told him there are other better parts of life, and look at the emotional front. I counseled him for at least 15-20 days. I gave him certain pranayamas. I made him change his lifestyle, and the whole thing stopped. So he actually saw value in what I was giving him, because I told him, don't try to cure yourself through this word.
Okay.
This word means something to you, but it doesn't mean anything to me. You look at it from the point of view of what I'm trying to tell you. Okay. Let's look at it differently. Let's give a holistic understanding to this whole thing. Now, if your heart is telling you something, let's try to listen to why the heart is trying to tell you that. Okay. Now, if you give it a name, then you have a very typical, it's a protocol.
I already enclosed it.
Yeah, you have a protocol.
Would that be how allopathy would deal with it? Would that be how allopathy would deal with it?
Well, again, atrial fibrillation, one of the precipitant things is the raised sympathetic drive, which he's trying to talk about. That if I'm driven, or I'm stressed, or I'm emotionally, then all my catecholamines are up, and catecholamines can precipitate this atrial fibrillation. That is one of the causes. There are many other causes. So if I tell Ravi that
as a cardiologist, if somebody comes with a similar case, what would you do?
I would. The first thing is that there are paroxysms of these, that they can be most of the time normal, but you can get these in bits at times. In which case, there are ways we don't treat it overnight. We just do a lot of things like what he said, lifestyle change, getting your.
So it's a slow process.
It's a slow process. But if the guy is in chronic atrial fibrillation, and we have because the risk there is of stroke. Chronic atrial fibrillation, the biggest risk is stroke to the brain, because if the heart doesn't work well on the upper chamber, clots form and then you go to the head and you get a stroke. There you can't take this risk of chronic therapy, because there you have to anticoagulate the person, give a blood.
And you have to take instant action.
You have to take instant action, because otherwise you will risk a stroke. So if I have paroxysmal AF, I will try everything. First, exercise, get your stress down, get your lifestyle to get your blood pressure down, sugar down, all those things come down. And if it doesn't go, then we have to treat with sometimes a medicine, which is a handbrake, which is what we call as a beta blocker, which is simply what we're doing artificially with a medicine, what we're trying to achieve. Otherwise, by just slowing yourself down by pranayama or exercise or whatever you're trying.
So this
to say.
beta blocker that doctors talk about, do you have an equivalent of that in what you are doing, formulating new?
Yeah, that's pharmaceutical. What he is talking is a beta blocker, but with other vascular resistance, they lower the nutraceutical will lower the vascular resistance, so that will ease up the blood flow, and maybe in other way they will integrate.
So yours is a completely made medicine which you will prescribe, or is it which some doctors
These are
use?
not medicines; these are all health supplements.
Okay.
And this is more of a the natural extracts, or taking essence from Ayurveda, Siddha, or some traditional medicines like Chinese medicines. We formulate some of the old time-tested things like Arjuna bark. Take the extracts and see that there is no heavy metals or any such things.
How do you do that?
We have analysis.
Oh, so you're going to modern industrial processes.
Yes. We have all analytical reports to judge any pharmaceutical ingredient or a nutraceutical ingredients. It follows the same purity. So from the harvesting a crop of herbs, say Arjuna, you try to take a lot of the pollution which is there in that soil. So we need to take out from that level and then take it into the purity of what you need exactly to work as a molecule. And that is going for the capsule.
So yours is basically like a pharmaceutical industry only. Only thing you're dealing.
It's not under drugs. It's under food.
Okay. So people who practice it are not necessarily doctors, or are they
The doctors
scientists?
are
Whatever.
there. That's what it's any healing practitioners. Like it can be a doctor. We call them mostly nowadays. They are integrative, as they are saying. Like in US, we are following the same thing now. And most of them are they call as health advisors. They can be a doctor, they can be life coach, there can be integrative medicine experts.
So like Luke would be taking an input from you before he recommends, or how would you interact with him, and fruitfully, in what way would he be able to?
So see, for example, when I moved back to India to start practicing in cancer, I needed curcumin, which is an extract of turmeric. Okay, highly anti-inflammatory. There may be citations or not, but Ayurveda has it as one of the oldest systems of science and medicine in the world. And people in India got treated like this over the last thousands of years.
They must be dropping dead like flies too. Would we know what would be the kind of?
No, because cancer hit India very late, and that happened when lifestyle started changing.
Was it because we didn't
follow
diagnose it?
the lifestyle of US and
we started imitating the lifestyle of the US, and that's when everything started changing. So yes, I would, in his field of expertise, just taking turmeric may not work for cancer or even an after bypass surgery spice given. I need a level of pepper, piperine, in that to make it bioavailable to the body. So you absorb maximum of the benefits of turmeric at a cellular level. So that's where nutraceuticals come in. It's combinations, it's formulations. Today the world is full of protein powders and supplements.
So it's like a lot of scientific work. I mean, what are you talking about?
Yeah, science is measurable, it's quantitative.
It's a very new branch of pharmaceutical, basically. And it's driven by the new health industry, what is going on now.
And are there more countries doing this sort of thing? I mean, when I say more countries, I mean Indian medicine is one of them. Chinese medicine is also lend itself to.
Yes, the highest consumers are in US, the number one. The US is $50 billion market.
But I thought it's outlawed in the US, all these kind of things, other than.
No, the alternative medicine you can take, but it's not in the
And the insurance companies don't pay for it.
Yeah, I'll tell you exactly. It's not covered by insurance, and everyone in America is covered by insurance. So they don't want to spend on a treatment which is not paid for by the government. So when I treat cancer patients, and a lot of them move alternative, a lot of them move back to traditional treatment because it's paid for. So it's a very cleverly, whatever, chemo, radiation, allopathy and stuff. You don't have to pay for even the drug that you take. So it's a very cleverly designed system. Which is why most of the alternative, hospitals have now moved to Mexico because they don't come under the scanner of the FDA. And some of the best hospitals which have statistics displayed, 96% survival rates, fourth stage cancer, exist in Mexico because there are no citations to block creativity.
They don't care.
They care, which is why they have results.
When I say they don't care, I mean they don't care for citations.
They don't, because see, citations are great. It brings discipline in medicine and science, but it is also limiting creativity. It's a way of the government to say like, don't think too much, basically don't find something that threatens the pharmaceutical industry. The pharmaceutical industry has been trying to patent herbs and plants and spices for years. 60% of the influenza medications used in India is from a spice, the star anise spice, shikimic acid, 60% of that.
Okay.
If
you take that regularly in your diet, would that...
Yeah, the Thais do that. They boil it in tea, and which is why they repair immunity, and even post breast cancer patients and cardiology, cardiovascular disease issues, open heart surgeries for healing to bring down CRP, which is inflammation.
It's such a
they have shikimic acid.
Tough wall, or a hard separational wall between oncology as we know it and your kind of...
I don't think so. It's changing. See, when the vision of the patient is in mind that you want to heal the patient, I would use 10 experts. I would use 10 cardiologists if I needed it.
True.
There is also a lot of ego that exists in this field. There's no doubt about it. The doctor at some time will say, no, this is my way of treatment. You do it, otherwise I'm not treating you. But I think what the magic is when everyone starts bringing talent in an organized way. You use allopathy. You use a cardiologist. You use nutraceuticals. You use his method of training. You use food, which we know is medicine. Food alone will not cure people, but food with everything else in an integrative manner brings about healing. That's what I believe in.
In fact, I have worked with allopathic doctors also in the past. One is we have to stop using this word alternative. Because we alternate to what? In fact, I asked allopathic doctors, if your grandfather were to be born earlier, would he be your grandson or what is it? Because Ayurveda has been here for 5,000 years. So how can he become an alternative to a science which is just 300 years old? So we should stop using this word alternative. We should say natural medicine. So I'm not alternative to anybody. And if I'm a better alternative, then I'm the main one. Because ultimately, after trying everything, a person comes to the Nadi.
Yeah, but it looks like it's more like all hope is gone.
But ultimately, today, Madhav, I'll tell you, I am proud to say this. In fact, a lot of my friends also would tell me this, that a lot of people, when they're given up everywhere, they say, the old Nadi Vaidya, just go to him, he will heal. And I heal. Which means to say, I'm the main guy, I'm not the alternative.
Yeah, but they come to you generally at the last protocol.
Yeah, so
but it's a fantastic point that he's making because like doctor just said, treatments like alternative, I'm using the word again, may not work after third stage or fourth stage. And I'll tell you why. By fourth stage, most oncologists will tell the patient, go home and rest.
Absolutely.
Then they come to us, and now for me to get an already diseased and already crippled body, which is destroyed with radiation, to even absorb nutrition, that becomes a problem. The problem is absorption.
You can say what I'll agree, because they have been told that there is no chance of survival. And the patient comes to me thinking, I am God and I'm supposed to heal the patient immediately, day after tomorrow.
But it's also a great relief for you that you're not expected to cure him at all. He's coming to you almost gone. So
no, but
in many ways you say it's okay.
See, first of all, I tell the patient that if you think you have cancer, you don't. Because your mind is cancered.
Okay.
Why don't you look at the fact that you are this, Ayurveda says dis-ease, dis-is, which means you are not at ease. So let's not give it a terminology. If you're giving it a terminology, then you live by the terminology of what is referred to in whatever is called modern science. What I'm trying to say is, you try to look at yourself as a person who's not at ease, and let me see through your Nadi pariksha what's causing the problem.
Okay.
That's exactly where I start.
And it's
Pariksha.
My contention about this is great, but what I'm trying to say is, today you need to have, this is a great part of placebo medicine. In every trial, well, I'm talking as a medicine guy, the guys who get placebo, that if I get a pill and say that I don't know what this pill is. It could be the medicine or it could be something else, chalk powder, whatever. The people on the chalk powder also feel bad. And the problem is the placebo. That's not a problem, it's a great part of placebo.
Yeah, it's a placebo
the
effect.
Placebo effect is fantastic because it sort of makes people feel good. It feels, okay, I'm taking
I got some
I'm
fresh
not
hope.
taking something, I have some fresh hope, and I'll be fine.
Yeah.
So, we need to differentiate these two things. What are you doing as placebo, and what is exactly the nutraceutical, or what is the life coach doing, or what is
What he's doing.
your integrative part doing,
Yeah.
which is different. And that is the only way you can run that is by running a randomized trial. And that is what medicine is all about. Clinical medicine, for example, I tell you vitamin E. I'll tell you the classic thing of vitamin E. Vitamin E was a very important drug and everybody used to take it. Say fish oil, omega.
Oh yeah.
A lot of people take it.
Hot favorite.
It's a hot favorite. Everybody pops it. And even cardiologists say, oh, if you have some triglycerides, take the fish oil. If you can't eat fish, you're a vegetarian, take the fish oil. And everybody used to take it. Vitamin E is to be taken. And when the big randomized trials came comparing vitamin E in the capsule form, you can't blame that the pharmaceutical be, because you would be interested in selling pharmaceutical. We found it was a placebo effect. The fish oil also, we realized quickly.
And I knew I was wasting my money having omega 3.
Omega-3 fatty acids is not written off.
Okay, still there.
There's
a point,
still there in the
there's a
running.
point
Fish oil is
I'll
there.
come in that picture. The vitamin E trial, what he is telling, is done on a synthetic vitamin E, which
Oh.
is not the similar natural one,
As in-
mixed isomers, what we use now.
Okay.
The trials done in that study, I
Oh,
also
why
know
wouldn't
that
they?
study.
But why wouldn't they use the original one?
Yeah, because most of the drugs are now full of synthetics. It is now like 5 years now we are
Going
looking
back
into the natural form of it more often. It's a mixed isomers we call, and that is effective. That again the study came who charged onto that publications, and
So
there is an effect.
finally, is vitamin is E good, bad?
Well, at this point of time, I don't know whether it's good or bad, but it has no evidence. That's all I can say.
Ah.
So if I have the evidence, I will pick it. So if I have to say that vitamin E in your formulation is run on a randomized trial, say again compared to the synthetic vitamin E, and say that this is good and that is bad. See, if I can run that, that's great. Then
What
that's how-
happens is
Maybe
the
that's what you
molecule,
need to
the
do,
molecule
prove.
got synthesized in a lab from petroleum,
yeah.
petroleum, basically tar. Even they make all the sucralose, they make from that. So when you do it, synthesize it, body don't understand whether it's my molecule or should I digest it properly. So they don't absorb at all. So body needs vitamin E, the form they need it. So that's the natural form, which you get it from wheat germ oil.
Okay.
Or something like any groundnut. They have a very significant amount of vitamin E, which is natural, but it will be very.
But has
costly.
this been proved, or you're just
No,
injected?
it's a comparative study done on the synthetic one and the natural mixed isomers taken from wheat germ oil.
This automatically you should be stopped using these kind of things for even a test, or it makes no sense.
No, what doctor's saying is absolutely correct. The omega-3 market is a market. People randomly use it. Even heart patients don't really need it because sometimes having more of the omega-3 actually disturbs the ratio of the omega-3 and omega-6. There's a ratio involved. So now everyone, to prevent heart disease or even after, take omega-3, and today in cancer research, excess of omega-3 from fish oil is even linked to prostate cancer.
Yeah,
So
there's
even
no
a
getting away
vitamin
from
E,
this.
I would never subscribe a vitamin E to anyone. You get it in almonds, you get it in groundnuts, you get it in pumpkin seeds. First have that. Now if you're lying, if you've undergone a treatment and your intestines can't even absorb that, then I'll look at one of his formulations which help drive that nutrition at a cellular level. But what he's saying is absolutely correct. Omega-3 is an industry which people are randomly, it's a market basically. So it's just not pharmaceuticals, it is also nutraceuticals which can be misused at time. Everyone doesn't need it.
Well, lifestyle disorders basically started when we moved from the hunter group to agriculture. Well, lifestyle disorders basically started when we moved from the hunter group to agriculture. It started then. When you were the hunting,
You stop wandering around and
you
stay
stopped, you took fresh vegetables, you took fresh food, even you had fresh meat without cooking. That's fine. those sort of meat didn't create this sort of disease. They created some other problems. You could get an infection and die of that or something else, but didn't create these diseases. Also, you were hunting around, running around, keeping yourself active. So, moment you move from the hunter-gatherer to the agriculturist, which basically means growing rice and wheat.
Sedentary, more or less.
More
stay in one
sedentary.
place.
And now we're moving one step further, which is further sedentary, which means not at all walking, going by cars, whatever you're doing. You're going to get these lifestyle disorders. The problem with lifestyle disorders, it's a whole system problem. It is not like pancreas problem or liver problem or heart problem or brain problem.
Yes.
It is an overall problem. And what you need to do is treat the whole problem rather than treat a disease.
You will make medicines like that which will treat? Or
well, ultimately,
won't be medicines.
it's very easy to, let me talk about a medicine. It's easy to give a medicine and people accept it as a medicine easier than telling somebody to eat well and exercise very well.
It's too vague and can't really.
Not only that, it's more difficult to do.
Okay.
So, American Heart Association has spent billions of dollars trying to educate people about so many things, but lifestyle disease just got worse, and people just ate more and walked less and did less exercise. So ultimately, you can't just say, we will just worry about all these things and not worry about certain things. But the fact is that lifestyle disorders, though they are increasing, their problems related to it in many parts of the world are coming down, say like Scandinavian countries. It's coming down because people are, at least the smoking part is out of the way.
Yes.
People can't smoke in public. Problems
There's no
there.
places to go and smoke.
People are, doing more of fish and things like that and vegetables rather than going into many other things which are cooked.
So you mean inadvertently it's sort of
it's
being handled?
coming down and in many parts of the world. It's not happening yet in America in a significant way, but say people are living longer, though the disease is getting more. So it's not that medicines have not done anything. Medicines have done a great part to all things, but in part related to also taking care of basic things like stopping smoking. And it's becoming more and more regulatory in various ways. You put salt in packed foods, is getting more difficult to do. You put oil, you have to put in the US, right? How much of oil is what type of oil is.
Yeah,
which is not
polyunsaturated and all these things. So in nutraceuticals, as you were talking about, you are making medicines to cure, or you're just going to maintain whatever the problems are. What exactly?
See, the nutrition is a part of your, the protocol
No, but the
of your life.
nutraceuticals part of it.
Yeah, nutraceutical is the more quantum effect of nutrition.
Okay.
It's like, you are taking antioxidant from apple.
Mm.
So why we have to do that? You can always have one apple a day and put your doctors off. So, but that's not the way. Now, the apple, potatoes or any leafy vegetables, you don't get the nutrient profile as it was 50 years back.
Okay.
So there was a depletion of, so many nutrients in the packed vegetables, whatever it was. And then we are storing it frozen and
A lot
other-
of changes, yeah.
Yeah. So what we take now, you don't have to take one. It will be maybe around 10 apples a day to get that kind
Same
of
effect.
antioxidant profile. Okay. So to get 10 apples, it will be much more costlier than taking one pill.
So that's where the kind of
the
research
nutraceuticals
nutraceuticals
works,
are doing. And have you been able to do it for a lot of lifestyle problems, diseases?
Yeah, we
What are the ones you handle successfully?
we have as the cancer, what he is speaking, like the integrated way of some of the vitamins and minerals in diabetic, and we have done it for a lot of inflammatory disease like joints, ache, and digestive disorders with probiotics. We have a lot of cardiovascular, circulatory improvement. So those are all some of the things which, again, it will be more of a we don't say cure.
Yeah,
It has to be. Now the problem is whether then we need to take it for the whole life. I said, it's a food. Nobody will say that you take food only for 2 days or 10 days or 3 months.
so this will be part of your life
So
also.
I
now.
don't know. I think significantly no negative side effects at all. Like
Which I think is possible.
Yeah, like other medications, what he is going to have, like antibiotics. So when you take antibiotics, your good bacteria also gets killed.
Yes.
So now it's a protocol for most of the doctors who are integrating a probiotic in their prescription. So you need to have the good bacteria again once you take antibiotic.
So, Luke, are you also related in some method to this whole nutraceutical movement? I mean, to make.
Yeah, like I said, I will use nutraceuticals a lot. Like, for example,
But are you more in favor of natural foods and stuff like that, or you don't care?
It really depends. Like for example, fourth stage cancer, sometimes chemo destroys the intestine so much. Now that's the organ that actually absorbs the nutrition from the food.
Yes.
So now food may just not work because it's not getting absorbed into the system. So then you have a nutraceutical with something like pepper that helps it absorb into the system. And by the way, these are all backed by a lot of science. It's bioavailability. So you will challenge the calcium and the D3 industry, which is one of the biggest in the world, with pharmaceuticals. Pharmaceuticals manufacture that. The bioavailability of most calciums hardly hit 30 to 40%. So it may be 1,000 mg of calcium, but your body's not absorbing 1,000 mg. It's synthetic. So that's where, there is, and I will support the use of antibiotics by a doctor, because the idea is first get rid of that bacteria or virus.
Yes.
But doctors who will prescribe a probiotic or tell them to take a B complex, because antibiotics deplete, like he said, the good bacteria and B vitamins, which are essential for good health and immunity. That's a perfect prescription.
So it's not always going to be win some, lose some.
No, it's got to be, if there's a medicine, use the medicine the right way, but also tell the patient how you can manage the side effect of that or how you can improve your lifestyle. Like he rightly said, he will tell people to exercise, to do everything besides that. He won't just give a medicine and say the medicine is going to fix you. So that's good medicine. You use a medicine when you have to, but back it with lifestyle, back it with, logic and understanding.
I would like to contribute here actually. I would like to go a couple of steps back before talking about medicine. For example, if you take food, it has to digest. If you take the medicine, that has to digest as well. If it doesn't digest, then what is the medicine doing?
It's not your job.
So first of all, you need to understand why are you becoming sick. It's because whatever you're eating is actually converting to a toxin. So if the toxin is not coming from outside, it's being developed from within. For example, a simple case, if you drink water with food, food will not digest. Number one. Number two, you are looking at the TV and having food. Now what's happening? You are actually absorbing the emotion that is there, that is happening on the TV, and you don't even know what you're eating. So even if you give you rubbish, you'll be eating it because you're more involved in the TV. You eat food and immediately go to bed. Or you eat at the wrong times. I'll give you a simple classic example. My father had a walking buddy who was running a call center in Bangalore. And my father told him what I was doing, so he asked me to come and see him. Now this call center was typically having an Australian shift and also an American shift. Now most of the call center executives are all in the age group of 19 to 25, which is quite young, but they're all sick. So I went and told him, just give me 10 boys and 10 girls and put them in the Australian shift, which works from 5 in the morning up to 2 in the afternoon. Without any medication, 60% of them are absolutely fine. Now what is happening is that we are sleeping very late, we want to watch the stupid serials and then we go to sleep late. We eat very late, we don't know what we are eating. Now that is converting to a toxin. Now if I have to take a product like this, the product has to come with the education that first correct your lifestyle, because even this nutraceutical product has to be digested. Absolutely. So that's when, even if you take it for a lifetime, you'll probably remain right there because you do not know the basic of what you're doing. For example, you're eating sweet after food. Now, the secondary mucosa that is there in the small intestine actually increases in thickness and the food doesn't absorb. So, the malabsorption increases. That increases the kapha in the body. So, the body starts putting on weight. Now, that is the first reason why the liver actually becomes toxic. The liver becomes fatty. Now, there is one cholesterol, then there is a good cholesterol, somewhat good cholesterol, bad cholesterol, very bad cholesterol. It's such a confusion. Why do you look at cholesterol? Now we have a WhatsApp message saying that there is nothing called as cholesterol. Now, why do you look at all these things? I eat healthy, I eat whatever I want, I exercise. Now, what he's saying is exercise is fine. But why do you blame the food in the first place? First of all, in fact, we look at Christians who say that, you say a prayer before you eat the food. We also say, Brahmarpanam, Brahmahavev, Brahmagno, Brahmanahutam. It's like you are the God inside you. Participate in the eating. At least give respect to the food, the Annadata. The food is trying to do something to you. At least, for heaven's sake, look at it.
I think the way it's going on, we could talk forever. Literally, between formulating new medicines, Doc, you agree with some of it, not so much. But do you see a future for this, more and more people following this system? Or should they?
So the worry in me is not about, is really trying to, one, create a sort of a fear among people that all that's going to happen to you, and you better start taking a medicine or a nutraceutical or something else, what is it, and creating people who are afraid, making a fear in people that this is it. You go to the United States, you see, if your doctor has not, it's a television ad before a serial, that if you have not taken a blood thinner, call your doctor or something like that. Because you're sort of driving a fear in the consumer that you have a problem and driving them to take medicines or whatever it is. The clear concept is that there's more to it than medicine. Medicines are important and I have no doubt, like a drug like aspirin. There's no question, nobody is going to doubt that aspirin is a great drug. You have no doubt that blood pressure medicines have reduced. But if you take blood pressure medicine, don't do the right thing, keep on eating the salt.
So that's
the key.
finally where it boils down to. You got to do a change in lifestyle.
Actually, it's like this. I have been interacting with a lot of heart surgeons. Now, I ask them one thing. A patient comes to you with a heart problem. Now, you are trying to treat him for 2 to 3 years. After 3 years, you advise him a bypass surgery, or you advise him whatever you call that, angioplasty. I actually call it like, you have these plumbers,
fixing the drain.
Yeah, your quarter-inch valve is there, you put a half-inch valve. So there's nothing actually happening. Now, after all that, then the heart surgeon says, now you need to do something, you need to go to sleep at 9:30, you need to get up at 5 in the morning. That's what I've been saying all along. Why can't the heart surgeon tell him in the first place or the first day? Does he have to tell him only after he's earned his money?
Sure.
Well, I'd like to contest that.
I was just waiting for you to say something.
Well, the evidence is very clear that nobody does, at least in this country, the amount of bypass surgery or angioplasty done is so little, fortunately.
I see.
And the reason is because people can't afford it and therefore they won't do it. So we have clear evidence that for people we call as chronic stable disease or chronic stable angina, medical treatment is fine.
Okay.
Nobody is going to go and do any angiogram or angioplasty surgery. The second bit of people who come with chest pain at rest or acute heart attack or something like that if you try to do lifestyle change at that point of time,
no, that's too late in the day for
that. Guy will be dead. So that's where you fix, and you completely agree with you, whether it's surgery or angioplasty, it's just a plumbing job. But you can't say that the electric line is in problem, is going to short circuit, you don't call the electrician, you got to fix it. So that's what the surgeon or the cardiologist does. But the other question is, if everybody continues a great lifestyle, which is impossible in a way, and human beings will not behave like that, will disease go away? Answer is no. Disease is not going to go away. Because there is an issue of aging, there is an issue of natural worsening, and there is an issue of genetics, which is the most important thing. That you may be extremely fit, running marathons every day, eating well, getting up at 5:30.
But you're programmed against it.
You're programmed against it. At 40, you will get a heart attack.
Ravi, would you like to conclude where exactly you see the thing going in the future?
Well, frankly speaking, people today are upset with whatever is called modern because it doesn't give answers. And they're all being given a lot of big reports which are actually not required. In fact, AMS has, All India Institute of Medical Sciences itself has issued a circular saying that your annual reports are not required. It doesn't actually lead you anywhere. In fact, I've been sending this to a lot of doctor friends of mine. What I'm trying to say here is that if a person tries to understand his inner self, the outer world is just a portrayal of what you are inside. So we need to start going inward, try to search ourselves to see where we stand, and we actually are the manufacturers of our disease.
There you go. What about you? What do you feel about
I completely agree with that. That's my philosophy as well. But
And
at the same time,
Yes.
like he said, humans will behave differently. I have 4th stage lung cancer patients who are still smoking 10 cigarettes a day. Now I'll definitely say chemo, radiation, whatever it takes.
And 2 more packs of cigarettes. So
Including heart patients. They will not do what the doctor says, and then that is the best treatment. But again, aligning both, those are people who they're not living as per their inner self, like he said. There's something going on. The fact that, they don't value their life and their health and they're still smoking when everyone around is telling them to stop, they need inner healing the most. So now I see, an alignment between both these departments,
Yeah, we need
it's
to take
both together.
responsibility
It's
for our
integrative.
health starts from us.
So you heard it from all these people. They are the experts in their field. we could go on talking about this forever, but I see a kind of melding of ideas. Maybe there's going to be more interaction as we go forward, and the medical industry will. That's no other way to describe it, but the medical industry, maybe they will see the goodness in what all four are propagating, and we see a better line of treatment. So thanks for watching, and thank you guys for coming. And we should meet again separately. also. So thank you.
Thank you.
Thank you.
Thanks.